Stroke is the fourth leading cause of death in Singapore. Stroke survivors may continue to have some form of physical disability after their discharge from the hospital. Thus, they may require assistance to roll in bed, get out of bed, and sit up on a chair. It is important that caregivers know safe handling and transfer techniques so as to minimize injuries to themselves and the patient. This video clip shows safe handling and transfer techniques with demonstrations by a physiotherapist. However, if you have not been taught by a healthcare professional before, please make an appointment with one before attempting this yourself. How to handle the wheelchair parts? For patients who require maximal assistance of 1 or 2 people, buying a wheelchair that has removable footplates and armrests will definitely make transfers easier. To remove the armrest, press the latch and lift the armrest. To put it back, simply push the armrest back into its attachment and ensure that it is secure. To remove the footplate, move the footplate upwards, press the latch and swing the footplate backwards. However, if the footplate gets in the way of transfer, you can remove the footplate. To put the footplate back, approach the wheelchair from the side. Fit it into the attachment and swing the footplate back into its original place. Always make sure that the footplate is secure before transporting the patient on the wheelchair. Position the chair nearby at a small angle to the bed for transfer. Allow space for the helper to come in. Make sure that there is enough space at the edge of the bed before rolling the patient over. First, place the opposite paralyzed arm on the patient's body and move the arm closer to you away from the patient's body. Next, bend the opposite knee. With one hand on the pelvis and the other hand on the patient's shoulder blade, roll the patient towards you. Remember to ask the patient to participate in the activity as much as she can. Next, bring the legs off the edge of the bed. Stabilize the patient's hip with one hand and with the other hand under the patient's upper trunk, lift the patient up to a sitting position. Your helper could assist you with the patient's trunk. Never lift by putting your hand under the patient's neck. If the patient is sitting too far in the bed, shuffle the patient's bottom forwards. First, lean the patient on the right and guide the left hip forwards. Lean the patient to the left and guide the right hip forwards. Ensure that both of the patient's feet are placed flat on the floor. Place the chair near the patient's strong arm. Ensure that the brakes are applied. Ensure that your helper is ready to help you. The helper will assist you by lifting the buttocks across. Make sure you communicate to your helper how he is going to help you. You can cue your helper by saying 1, 2, 3, lift, and lift upon lifting. Lower yourself to the patient's eye level. Make sure you bend your knees and keep your back straight. Stabilize the patient's knees between yours. To transfer, lean the patient forwards. Ensure that the patient's weight is well forward. Keep your back straight for the transfer. Make sure that your path of view is not blocked by the patient's head. Pivot at the patient's knees. Bring the hips over to the chair. To shift the patient further back into the chair, first lean the patient forward and to one side, with one hand supporting under the patient's thigh and your helper assisting under the patient's hip. Together, bring the hip backwards. Repeat for the other hip. Make sure that the patient is well seated back into the chair in a well-supported upright posture. Finally, ensure that the footplates are secure. Tips for safe transfers for the caregiver. Familiarize yourself with the wheelchair parts. Position wheelchair at an angle close to the bed. Keep your back straight during the transfers. Bend at the knees instead. If you have difficulty in transferring your loved one affected by stroke, ask a doctor to refer you to a neurophysiotherapist. This is available in all the hospitals in Singapore, as well as community rehabilitation centres.